Hey guys, this is Spencer Coburn live from Los Angeles. And I have a really special guest that I wanted to come on actually for a long time. And we decided to have him on for an afternoon interview. His name is Dr. Ken Williams, and he's a board certified primary care physician. And he's also a cosmetic surgeon. And he's really one of the first guys to be trained and to adopt, I should say, the NeoGraft hair transplant machine into his practice. And I contacted Ken in the past about my concerns on how the NeoGraft may be marketed in the near future and in the future. At the time, this was several months ago. And lo and behold, if you guys saw the last interview with Dr. Alan Bauman, my concerns have really come to fruition. And I wanted to have Dr. Williams on to talk about his experience with NeoGraft. Thank you so much for joining us this afternoon.
My pleasure, Spencer. Good to be here.
Yeah, it's great to have you. And why don't you tell our listeners and viewers a little bit about yourself?
Oh, absolutely. I'm a board-certified primary care physician. I think, as you expressed, I started practice way back in the days of the mid '80s, and I thought I was going to be the Marcus Welby of family practitioners, primary care docs. I loved it. It was my bread and butter. I loved talking with patients, providing them good medical care. And then for the last 3 years, I've sort of made this entrance into aesthetic cosmetic medicine. I first adopted, like most physicians, the easy stuff, the Botox and the fillers and the laser and the skin care. And then eventually I just do one major procedure, and that's local wave tumescence liposuction. And then in 2009, because of my own personal impact with hair loss, I was introduced to automated FUE at the Academy of Cosmetic Surgery there in Phoenix, and fell in love with the concept of a minimally invasive procedure for my hair loss. At that time, I don't have any pictures, and maybe we might get them for the listeners. But
Sure.
I was, like most hair loss sufferers, wearing a 0 and a 1 cut because I just had nothing on the frontal hairline in the mid scalp, and I had like a Norwood 5, 6, and it was very embarrassing to wear my hair long. So I just kept it short and saw the NeoGraft device, and went into it and did a lot of investigation study, and attended, like in the last year and a half, like 6 or so of the live surgical conferences and symposiums held by the International Society of Hair Restoration Surgery.
Right.
And it's just consuming. I loved it, and obviously I've had the procedure done too.
Well, what's unique about that is, having you on, I don't mean to cut you off, but having you on the air to talk about the NeoGraft, to talk about everyone's concerns about the NeoGraft, and being a NeoGraft patient yourself, I think it really, it speaks to the idea, and I've been putting this across since I've been talking about the NeoGraft. I have nothing necessarily bad to say about the NeoGraft machine itself. It's not about the tool. My concerns have always been, and they still are, that this hair transplant device, this machine, will be getting into the wrong hands. And what I mean by that is that, in some cases it's going to be unskilled hands. In some cases it's going to be apathetic hands, if you know what I mean. Doctors
Absolutely.
who really don't care about, the cosmetic result of the procedure, or don't understand the entire scope and possible pitfalls of this procedure, and think it's just a way to, expand their practice and make an extra couple of million. Hair transplantation is a viable option for so many men and women, mostly men in my opinion, who are dealing with androgenetic alopecia and other forms of maybe traction alopecia and other types of hair loss like that. But you guys have come such a long way in creating a technique that is basically undetectable. We're now, for the first time in the last decade, I would say, hair transplantation can be an option that people don't have to be afraid of. It can really change their lives. I truly believe that the NeoGraft, if it's placed in the wrong hands, and I think at this point it is to some degree, it will set the industry back decades. People are going to come away with unsightly hair transplants. They're going to feel like they've either been, in some cases, as badly as maybe being disfigured, at the very least ripped off, and it's going to give the entire industry a bad name. And I see that evolving, with the way the NeoGraft is marketing this device, and from what I can see from the business plan, and I know you and I have discussed this in the past, and you've brought up some concerns as well.
Oh, absolutely, Spencer. I think if one enters into hair restoration, there has to be a reason for it. There has to be a passion. For me, it was, the personal impact of how much it has changed my life. I mean, I just love having hair that I can comb now. It makes you much more youthful. But when I see it being, in a way, promoted, that it's pure monetary compensation, and there's no patient education and safety, and it's just about making money. And when I talk to my peers that I've met, and that's the reason for getting into hair restoration, I don't feel comfortable with that. And I was at one of the, in Matt Levitt's Orlando Live Surgery this year, and I happened to be talking with one of these surgeons, and he was a plastic surgeon. And he told me how great it is. He doesn't have to be in the room, and he can do his breast implants, and he can do a little bit of this and a little bit of that. And he can just check in a little bit. And this was his first hair restoration conference. And again, you can't acquire these skills and knowledge and insight, especially the artistry and the passion. Those are things that just can't be taught in just a few days. And I was, this surgeon was telling me this and how wonderful he thought this was. And I turned around to him and I said, Spencer, I said to him, that is not the reason to do this. And you have to love what you're doing. You have to be a part of the patient's care. You have to be emotionally involved and invested in their lives. And if you're not, you're doing it for the wrong reasons. Because money is going to ruin, like you say, the name of NeoGraft, the search for this monetary remuneration for the procedure. If that's the only reason you're doing this, you're going to fail.